More and more women are deciding that the best place to have their babies is in the comfort of their own homes. This series follows these mums-to-be who are determined to have homegrown babies. In Midhurst, Sussex, Aida lives with her husband John. They're expecting a new brother or sister for their existing 5 children.
My name's Nadia.
And how old are you?
10. Is it? And I'm 9.
I'm Lisa and I'm 8. And I'm Aisha and I'm 4. 5!
And this is Zach, he's 3. The first one was quite a long labour, but I don't think it was horrendously long. But I'd made the mistake of actually going in early. So had the "will break your waters" or "you're in pain, we'll give you pethidine." And basically, in the end, I think after about, I'm trying to remember, 24 hours, it ended up with a Von 2 with a massive episiotomy. Number 4 was a home birth. That was at the beginning of my, possibly just after I started my midwifery training, and I had an independent midwife then, and it was a lovely experience, and we were really looking forward to it, and the care was so much different to what I was used to.
Aida's been a practicing independent midwife since the birth of her last child, Zach.
2 days after I gave birth to Zach, I had to hand in all my paperwork for my midwifery training. That was the deadline, and there was no stopping me. So on the day when he was 2 days old, I was finishing up my paperwork and going back to the hospital to hand them in.
And you don't feel that?
The experiences I've had in midwifery for the past 3.5 years have been vastly different to the experiences I've had when I was training. And I've been really privileged in the past 3 years to actually have worked with women who, yes, some of them had really crappy long labours, but they dealt with it differently.
Why did you do that, Aida? Aida's chosen her colleague, independent midwife Andrea Prescott, to attend her for the birth of this 6th baby. This time, she plans to use a birth pool.
When you're feeling like, God, I really hate this bit and I don't like it anymore, that's a good time to get in the pool.
Yeah, I don't think I'll get in immediately.
No.
I might get fed up with it as well.
Yeah. And you're quite active, you move quite a lot, as I remember.
Yeah. I might try to. Because I've got it in my head, once I'm in the water, something's going to be happening, so I'd rather wait until something might be happening.
Andrea was the attending midwife at Aida's last 2 births.
I don't think she's too keen on labour. I have some clients who afterwards will say, yeah, no, that felt okay and good, and I felt really powerful, and I doesn't quite feel the same way usually, so we'll see how it goes this time. Yeah, what we really want when you, just before and when you go into labour, is get that baby in a really good position, don't we?
There's a little bit in me that actually accepts that I might have to have long labours, and as far as I'm concerned, 12 hours is not a long labour really. And but also I've been doing lots of thinking and working out in my head, I don't need to have a long labour, and I think sometimes you can get into this trap thinking, I've always had long labours, I will always have long labours, and now I'm thinking, no, maybe I don't need to have a long labour, or it doesn't need to be as uncomfortable for as long. And I think mindset wise, I'm in a more stable, positive place for childbirth.
Aida also plans to have a lotus birth this time. Some people believe that by leaving the placenta and cord attached and allowing it to separate naturally gives the baby a more gentle start to life and may make them a calmer baby.
Lotus birth is when you do not sever the cord from the baby, you wait for the placenta to be delivered and basically just leave it on until it naturally falls off the cord naturally falls off the baby's belly button. umbilicus, and that normally takes about 4 to 7 days. And lots of people, when I talk about it, they go, ew, wouldn't it smell? And the thing is, and these come mostly from student midwives actually. And I have to say, placentas do smell when you're on the ward, because you handle them with gloves and you wrap them up, with paper and stuff like that, and you don't wash them. And from my experience now, since I've been qualified, where I do wash the placenta if the women are keeping them, placenta, they just don't smell if you wash them.
Well, it's Wednesday, 8th of March, a day before my due date. Going by my menstrual cycle, I should be due around tomorrow, give and take a few days, possibly. I'm aiming for sometime around the 12th or the 13th of March, because that's when the full moon is, and from my experience, women tend to go into labour nearer the full moon than not. I've been in contact with my midwife on the phone, by email. I haven't seen her for a week, which it's no big deal to me. I have no concerns about this pregnancy. I know that this baby's fine. I can feel it. I'm waiting for the nesting instinct to kick in. It's not happening. I'm just hoping that at some point in the next couple of days, this nesting instinct will come in and I'll start scrubbing floors and tidying the kitchen or something like that. People do ask whether being a midwife makes it easier, being pregnant, and I'm not sure. I think there's a lot of expectations involved. I'm actually still enjoying my pregnancy, and I think the baby will come when it comes, really.
Andrea's come round to give Aida a checkup. She's been having mild contractions, but isn't too sure if she's in labour yet. Everything's fine, and although labour may have started, Andrea feels that there's plenty of time for her to complete her other visits for the day.
When would you like to be called? Looking at Aida and what you think.
I know, I've had a conversation where she said that she sometimes has a bit of a panic and calls too early. And I don't have a problem. If you feel like you're panicking, you want me here, that's totally fine. So that kind of overrides anything else that I say.
Oh,
but
no. If she wants to call, then obviously I'm not going to stop her.
No, I know
I
that.
like the deferment.
But, if they're kind of... Because it takes me half an hour as long as the traffic's all right, and the worst it takes is 40 minutes. Basically, I suppose if your contractions are kind of... Once they start getting closer than 4 minutes apart... That's leaving it a little late.
4 minutes is the time which I decide to call you whatever she says.
Yeah, that's fine.
If she says,
we could still be actually a long way from
that.
that.
No. I'm not disputing that.
But it's just a kind of, particularly if they've gone from like 7 minutes to 4 minutes within half an hour, I really want to be on my way, because they're going to be sort of 3 minutes, 2 minutes by the time I get here.
Yeah, that's okay.
And being here when they're kind of 2 minutes apart is cool. But I don't have any problem. It's totally up to Aida, really, and the point at which she thinks, no, Andrea, no. That's good. All right then, everybody. See you soon.
I never get any bananas.
Oh, that's all right then. No, that's good.
You never get any bananas in your porridge. You're lucky to get porridge.
Mommy, we need more porridge.
However, Andrea's only been gone 40 minutes and Aida starts to have very strong contractions. She's got in the pool and already has the urge to push.
Doing good. You're doing very good. That's okay.
Hello, sweetheart. I love you. It's not bad, okay?
It's painful.
It hurts.
I'm scared about you.
But a baby's coming out. You're going to see your brother or sister. Well, not now.
No, not quite yet.
Not yet.
If only.
Andrea's on her way, but will John be the one to catch this baby? Andrea's arrived.
Hello, lovely. Can I just get in?
Mommy died.
Oh, she's babying. Can you say babying? She's babying. You're doing great. I can tell you're doing great. It just feels horrible, but you're doing great. Oh. Oh. Oh.
Andrea prepares the gas and air as Aida finds the contraction so strong she's in need of some pain relief. But Andrea doesn't want her to use it too much.
Because what you're doing with the contractions is so powerful, I don't want you to lose that. Just use it to gather yourself and then really go with your contractions because they're great. And there's, all the pushing you're doing is fantastic. I think your baby's probably quite low down as well, isn't it? Yeah, that's good. That's great. Fantastic.
The contractions are getting stronger, and Andrea now prepares the room for the baby's arrival. She has a warming blanket with a towel on top should she need to resuscitate the baby with portable suction and oxygen to hand. Aida needs some reassurance.
Andrea?
Yes, my lovely.
Tell me I don't need to transfer in.
You absolutely, categorically are not going in. Okay. Categorically.
Hang on a second, let go. Breathe normally while I'm getting it sorted. That's it. Now, come on, put it back in and slow it all down with you. Go on. It's all back to okay.
Big, saggy, floppy.
Saggy
breaths.
Breaths.
I've got ages to go.
You haven't got ages to go.
Only around 10 hours.
I can see your labia parting, your perineum flattening and your bum bulging.
Oh.
Ah.
Do you think we need to transfer in?
No! What do we need to transfer
You're
in?
asking me?
Andrea, you're going to have to transfer me in.
Okay, Aida, listen to me.
Yeah.
You've got to ditch that. If I think you need to go in, I will start to tell you when it
Okay.
becomes important. I am not thinking that.
Okay.
I'm really happy with how you're doing. You're progressing beautifully and very quickly for you. So just trust that you're in the right moment, you're doing the right things, it's all going fine. But ditch that fear, okay, because you'll let it get in the way. Don't let it get in the way.
You don't have to go anywhere.
You trust yourself, you're doing a brilliant job here.
You're just going to be here.
Aida's examined herself to see where the baby's head is.
It's not close.
But do you know what? Okay, that's an inch closer than last time you showed me. Okay? So that's really good. And that was only about half an hour ago.
She just needs some extra encouragement from Andrea.
You're moving baby every time. It's moving backwards and forwards each time. Are you feeling baby sliding down now? Inside. Yeah, there you go. Baby's coming. Absolutely. Because you're so bloody brilliant. Yeah, really and truly on its way, hey?
I'm going to see my baby.
Yeah!
I'm going to do it. I'm really going to do it.
Of course you are.
I'm going to do it. I'm going to give birth to this baby.
Yay!
Please, baby, come now. Please come.
It's coming, it's coming, it's coming.
Please come, baby.
After 1.5 hours of pushing, the baby's head slowly appears.
Wow, I can see baby's head. Wow! Your perineum's stretching up already now. You can probably feel it, can't you? Okay, so I'm going to probably get quite loud if you're using the Entonox in the middle of it, but I'll want you just to slow it down at a certain point. But keep doing what you're doing, it's great. It's very exciting. Here we go, here's your baby.
Oh, you are really special, my love.
Oh, that's lovely. That's lovely. Okay, you've got eyebrows. Eyebrows, eyes. Nearly nose. Hello. Hello. There we go, nose.
Oh, baby.
Yeah.
I can see it.
There we go. Okay, we've got a mouth and a chin. Oh, and an eye opening. Keep going. Keep working with those contractions.
Go ahead.
Yeah. Okay, big pushes. I'd like quite big pushes now. It's all good, all happening, all moving. Push. Time. Good. Good.
Andrea can now see that the baby's umbilical cord is by the baby's head, and there are signs that it may be distressed. She urges Aida to push harder to get the baby out.
We've got plenty of room there. I need a contraction, that's all. We're just going to wait for a contraction and then I'll come back with you. Okay, right, ready?
The baby's taking its time in being born, and Andrea starts to prepare Aida to get out of the pool to birth the baby on the floor.
Right, can we get some waterproofing on the floor, towel on top of the waterproofing, quite quickly, and can we have a light on?
But just as she does so, the baby arrives.
Hello, beautiful. Oh, sweetheart.
Cord's passing fine.
Everyone. See you. Can I sit down? Yeah. Well done.
Fantastic.
Sweetheart.
Good time. Okay, I've got it.
You've got ginger hair.
Never.
Freckles?
The baby is very floppy and pale. The umbilical cord is still pulsating, and there's a heartbeat, but it's slow.
Yeah.
Okay, lots of talking to this baby.
Come on, baby. Come on, Mummy's waiting 9 months
Eric!
to see you. Come on, Daddy wants to see you. Come on, that's it. She's kicking.
I'm wiggling her feet.
Oh,
Come on, sweetie.
come on, beautiful.
That's the one. More of
That's
that.
it. That's it. Come on. Come on.
Come on, we don't want to do anything exciting. You can't.
That's it. That's better.
And I'll just grab. Okay, I think we're going to get you out.
Andrea gets mother and baby out of the pool.
Come on then, come on.
The cord is still attached and continues to give the baby oxygen via the placenta.
I think we're risking
baby's lungs and you feel an awful lot better. And say, no, that's horrible. That's what we want you to say. Come on, baby. See that heart rate?
Come
Really
on,
good
sweetie,
heart rate.
cough there. Okay, you'll get there.
Cough. Cough on, Mummy. She's going to wake up and be so angry with me in a minute. Mummy.
Eventually, the baby pinks up and gives her first cry. The baby's brothers and sisters can now see their new sister for the first time. The following day, Andrea returns to check on baby Maya's progress. The placenta, which was washed after the birth but left attached to the baby, now needs some preparation to complete the lotus birth. Adding rock salt, lavender heads and geranium oil will help to preserve the placenta and encourage it to dry up.
I used to be really squeamish. I'm so not anymore.
I'm quite curious about the whole thing. Why don't you use your fingers rather than your knuckles?
And 5 days later, the cord has separated.
Yeah, basically it was a bit red, there, where she obviously pulled it before it was supposed to be pulled. But it didn't, it wasn't a hard tug. She just caught it between her big toe and the next toe, and it just came off.
Aida has actually enjoyed being with her baby much more than she has with any of the others. I don't know if it's the way we're treating it or the way it's actually totally in her control, but it's nice the fact that she wanted to have the pool, she wanted to do the lotus birth, she wanted to have Andrea as a midwife, and she wanted you to come and film it. Absolutely everything has been her choices, and I think that is actually really good.
A rarely talked about complication of pregnancy, cervical incompetence.
It's a shame you have to go through that to realise that that's what's wrong with you.
And sound therapy. But first, tears and episiotomy. During the final stages of birth, when the baby's head has descended and can be seen at the entrance to the vagina, the skin and muscle between the vagina and rectum, the perineum, stretches to allow the baby to pass through. Sometimes the perineum doesn't stretch enough and it tears.
In the medical world, we grade tears of the birth canal into first degree, second degree and third degree. First degree tears are tears that involve just the skin of the vagina or skin of the perineum, which is the outside skin. And there is very good evidence from studies done by both doctors and by midwives that first degree tears do not require suturing, they don't require sewing up, and that they will heal very well on their own.
I had a tiny tear, but they said there's no point, it'll just heal, once you start going to the toilet, it will heal on its own. So I was lucky with that, really lucky.
I tore 3 times, well, each vaginal birth I tore, they were all second degree tears.
Second degree tears, which involve not just the skin but also the muscle, and third degree tears, which involve not just the skin and the muscle but also the back passage. The same studies have shown that they should be sutured.
I had a second degree tear which healed very nicely without stitches.
I was stitched with the first 2, and they said with her that I didn't need to be, that it should heal by itself, which was nice actually not to have stitches.
Third one, he was big. He was 2 ounces short of 10 pounds. He came out looking like a sumo wrestler. So yeah, that was the last time I had stitches.
I know some people I know have had awful sort of infections and all the stitching's done badly or tightly and they have to have it done again, and it's a sort of nightmare. And some people I know years after are still uncomfortable.
I wish more people would speak up about their horror stories, about how damaged they've been from the episiotomies and how their sex lives have been ruined, and women just don't speak up. They just don't talk about it. Women don't talk about abortions, miscarriages or ripped perineums. Why not?
In the UK, 12% of all vaginal births will involve an episiotomy. When she was having her first child, Victoria had an episiotomy. A cut is made with a special pair of scissors to make more room for the baby to be born.
I had a 3rd degree episiotomy, which didn't heal terribly well because they stitched it too tightly. And I got an abscess on the stitches, so the midwife, when she came to visit me at home, had to take the stitches out and redo them because they'd just gotten infected and the stitching was too tight. And I spent 6 weeks sitting on the edge of chairs. I could not sit flat in a chair. Coming home from hospital, I was virtually kneeling.
For Caroline, her first birth experience with son Oliver left her deeply traumatised.
It should have been textbook birth. And it's hard for me to remember because I was drugged, so drugged. They took me off to the delivery suite, put me on my back, on the bed, and then all of a sudden, the room filled up with surgeons and gowned people, and the midwives would just look terrified. And then they told me that Oliver was stuck. And then I remember this Egyptian doctor, female doctor, saying, "We've got to give you an episiotomy," and they stuck my legs up in stirrups. She got the ventouse and forceps out and then started pulling me and the bed across the room. And after an hour of this, I felt saying to this woman, "Get out from between my legs, you are useless, just move." So she moved out the way, and this guy just said, "Come on, we've got to get him out on the next push." And I remember screaming I was in agony. I thought my back was splitting because I now know he was back to back. And it was like pooing a bowling ball.
When an episiotomy has been performed, and it would be done either with local anaesthetic placed in the skin where the cut was going to happen, or very often if the woman has already had an epidural during her labour, then the epidural will take away all the feeling of making that cut. Of course, that cut is then sewn back up, and because there's such a good blood supply to that area of the body, it heals extremely well in the vast majority of cases.
The tear was severe enough for me to be offered a transfer to hospital, and I declined, and my midwife sutured it for me.
In the old days, silk was used, and that was not absorbable, and so a woman would have to have the stitches taken out by her midwife, perhaps after 7 days or 10 days. Now that we have dissolvable sutures, we really look for sutures that dissolve over about 10 days, 2 weeks. This provides an optimum time for them to hold their strength and allow healing to occur, but doesn't allow them to hang around so long that they cause a reaction or cause allergy or provide a kind of focus for infection.
I've since had the wound site examined by a consultant, and her comment was, "Oh, whoever did this did a great job." So I thought, wow, if you're going to have a tear, well, at least you're going to have a nice perineum after the fact. That's all good.
With a nasty infection that had developed in her perineum, Caroline was having no such luck.
Eventually, after 10, 12 days, I was let out and I went home, but I couldn't walk, I couldn't sit.
And had it healed by that time?
No, stitches still very present. This last stitch was removed at 6 weeks at the GP surgery. And then for 7 years, I couldn't sit on the edge of a bath.
To try and avoid tears or an episiotomy, some women have found that perineal massage does the trick.
One of the best things I did was massaging oil into the perineum from about 5 months pregnancy. I mixed up a sweet almond oil with a couple of drops of lavender in there and massaged it and stretched it very slightly as well, and I didn't have any stitches or anything at all.
I tore slightly last time, but that's because I was just so impatient. I didn't listen to the midwife and I pushed when she told me not to. But it wasn't a major tear. So maybe it works, maybe it doesn't, but anything you can do to give yourself a better chance has got to be worth it, really.
I must start doing it soon, so I preach this to everyone and haven't done it myself yet. But that was, I'm sure, and I've recommended it to a lot of people, and it's worked for them as well. They haven't had any stitches, just because it just makes it stretch nicely.
A couple of weeks later, Caroline gave birth to baby Barney safely. All her preparations paid off, and her midwife, Anya Metzner, has come for a postnatal checkup.
How are you?
My perineum just gets sore.
If you're not sure about it, or if you feel something's happening that wasn't happening before, then just, tell me.
It's just rubbing a bit.
Right,
but it's always when, if I've been running around too much and I haven't sort of rested enough, it's just the same old thing really. But it can tell it's healing.
So antenatally, when you're buying all the things that you need once your baby comes, you'll be getting yourself some sanitary pads. Make sure you get the nice chunky, cheap as chips ones, because actually they support your perineum if you've got them in nice comfy pants, and they don't increase the heat that goes back to your perineum. Some of the plastic backed ones increase the heat and dampness, and it can irritate and be very uncomfortable actually. It's better to use the thick ones because there's more breathing.
By 31 weeks of pregnancy, the baby weighs 1,540 grams and measures 39 centimetres. The baby can now open and close its eyes, and it's learning to focus. The pupils will contract and dilate, depending on how much light gets through the uterine wall. The baby's fingernails may now reach the end of its fingertips, but its toenails take a bit longer to develop. By now, the baby is beginning to feel more restricted in the uterus, and the mother may become more conscious of less movements. As a general guide, 10 movements in a 12-hour period are deemed to be sufficient. If they are any less, the mother should seek reassurance from her midwife or doctor. If the baby is born now, it may need help with its breathing, but each day that passes, its lungs develop further, and most parents can be reassured that the majority of babies born at this time will survive with very little long-term problems. There is now only 9 weeks to go before baby is born. Coming up next, cervical incompetence. Tuning into your baby with sound therapy and how your hair changes.
Your extra hair that you would have normally have lost during pregnancy and does tend to fall out and fill the bathtub up when you wash your hair.
Cervical incompetence is diagnosed when a woman is found to have a cervix that's opening, or she delivers a baby extremely prematurely without any associated contractions. So if we see someone who's giving birth very early, usually it will be that the normal mechanism of labour has been triggered abnormally early.
Rachel discovered she was pregnant at 15. However, after the 20-week scan, complications started to occur.
I started bleeding, and we phoned the hospital and they were saying it was normal, just basically bed rest, which I was doing. The bleeding, as the days were going by, was getting worse. So we went to the doctors and basically they just reassured us again.
Occasionally women will come in and they'll have a little bit of discharge or a little bit of bleeding, and when we examine them we find that their cervix is partly open or almost fully open, and they've had no contractions to cause this.
I couldn't go to the toilet properly, and I ended up going to the toilet and my waters went, and as soon as my waters went, all the pain went. But we went up to the hospital straight away and they basically said that there's nothing they can do, and of course I had to give birth to him, which was horrendous.
What we think is happening is that the weight of the pregnancy, of the baby and the fluid around the baby and the placenta has just become great enough that the neck of the womb, whose job is to keep the pregnancy inside, is no longer able to do that.
With her second child, Sophie, Rachel encountered similar problems with her cervix.
The pregnancy went well again up until 23 weeks, where again I started bleeding, went to the hospital, and I was about 3 centimetres dilated.
Most people who suffer from cervical incompetence, which is perhaps 0.5% of the population, there is no identifiable reason why that should be.
They were again going to leave me, and obviously I would have lost her, but there was a consultant on the ward that said put in a cervical suture. It's a 50-50 chance So that was done. And then obviously when it was done, everything was okay after that.
Where we think the mechanism of that pregnancy loss has been because the cervix is not able to keep the pregnancy inside. In a subsequent pregnancy, we might stitch that cervix closed around about 13 or 14 weeks. So that would be before the pregnancy becomes heavy enough to just literally fall out of the uterus, but beyond the point where early pregnancies that are not normal would be lost.
With her third baby, Luke, Rachel was determined not to take any chances.
The pregnancy with Luke from start to finish was brilliant. The suture went in, I felt reassured. Obviously, when I was getting to sort of the 5-month stage, I did become a bit anxious because obviously my first one was just under 22 weeks, Sophie was 23 weeks. So I did get anxious approaching the 5-month stage. But I kept my cool and I just sort of like rested up quite as much as I could and kept calm.
In general, if that pregnancy continues perhaps to term to 37 or 38 weeks, we would then take the stitch out.
They took the suture out at 38 weeks and they told me I should really stay in because within 24 hours I will go into labour. I was like, oh no, because I'm not a good patient. So they did let me go home under the circumstances that if anything does happen, then obviously to go straight back in.
Most obstetricians would say that even where you've been absolutely convinced that's the problem, something about putting the stitch in when you take it out, often these ladies don't go into labour and very often you end up inducing them because they're overdue.
And I actually went to 41 weeks, so I actually went 3 weeks over with no suturing, which I was quite shocked about.
Very often the way we diagnose it and when we diagnose it, it's too late to do anything in that pregnancy because it may not be diagnosed until a pregnancy is lost extremely early.
The sad thing about people who do suffer having incompetent cervix is you have to lose a baby and then go through something similar for a second time for them to know that it is your cervix. And obviously I had to go through losing my first baby, which does still affect me. It does, and it probably always will.
That feels a lot easier, actually. Yeah, it's moving a lot better. Into this one.
Sound therapy is a complementary therapy which cranial visceral osteopath Lynn Bridgeford finds useful in some circumstances.
All right, what I'd like to do is, if you'd like me to, is have a look with some sound. Some sound therapy around the baby. Mm-hmm. See if in response he might move, or she might move. Okay, so all you need to do is just lay down. What I'll be doing is just using some tuning forks and making some noise around you, and depending where I hear something that might sound not quite as in harmony as it could be, then I'll, with the sound, choose a fork and let you hear it and then put it on your body. Okay? But more than likely I'll just wave them around you and baby. Okay? So if the noise is disturbing, just let me know. I don't think there's any scientific evidence of what it does, although having had treatment myself, I can feel tremendous changes in my body from having sound therapy done to me, where a vertebra will move without being manipulated. It depends what you're linking into when you're working. And basically, first of all, I'll clear the system down. It's almost like dusting, doing your housework, clearing the system down. So just to calm the body down, calm the system with a C and a G, so that's a fifth, which is a very harmonious interval. And then using that to find out where there's disharmony in the body. It's quite a subtle thing, sometimes less so, and you hear there's a disharmony. And you can get that when you first hit the forks, which is why sometimes I'm careful and do it again. There is a certain amount of intuition with it as well, obviously, and feeling what you're doing and feeling the vibration. And then finding out which particular fork the vibration will change again, depending on what you're looking for.
And does this have a calming effect on the baby? Is that what it's meant to do? Or?
Yeah, just balancing. You've got a frequency around what feels where the baby is, and then along that curve, finding where they point so it sounds like there's a disharmony, and then just gently working with that with the sound, and checking if it's gone, go on to the next one.
Mm-hmm.
So the idea is just bringing balance, harmony, release stress and tension. I mean, fetuses have stress like we do.
Yeah.
Well, different stress, but...
I'm going to give birth to a cosmic baby, aren't I?
I'm sure you will.
Yeah, they call it Sky or something, you know. Like that one.
Working up. That's where the head is, isn't it?
Yeah, and the fleece kicking here.
Either that or he hates it, saying, stop! Well, we'd like to make space, but this is the message we want to give to baby, and is to bring your head down here and kick here. That's the best position we want to be in eventually. It seems to help babies to move when they're not moving well. It seems to calm the mothers. Children love it. I've seen kids just go dead still. So it's a part of what I do when it feels necessary. Don't know if you can hear that, but it all sounds much more harmonious now. Kicks in it.
Mm-hmm.
During pregnancy, some women find that their hair changes. Some will find that their hair is thinner, and yet others will grow curly hair.
I've experienced quite different things with my hair this time. My hair went kinky and very peculiar last time. This time it's very flat and straight. I think the hormones play a big part in what's going on with your hair and how it is.
My hair fell out. My hair went really, really thin, and I had to have a lot of it cut off because it was really long.
A friend of mine, her hair, she has highlights, and you could see a band of hair that was lighter, and then you could see it was going through darker again. It was strange. Another client I did a few years ago, the whole back of her hair went curly, and then started growing out straight again when the baby had been born. It was bizarre. It just does the weirdest things on your hair.
But more commonly, it seems to grow thicker, and then following the birth, the excess hair falls out.
My hair, I think it's become stronger. I mean, normally when I comb my hair, I always lose some, but I haven't at all. So it's definitely gone stronger. I wouldn't say it's gone much more shiny or more beautiful or anything like that, but stronger for sure.
The information I have is that your hair doesn't really fall out during pregnancy. Your body seems to hold on to it, and that's why you have this thick, luscious, gorgeous hair when you are pregnant. And then it all falls out when you've had the baby. It's not all your hair falls out, I might add. You don't go bald, but your extra hair that you would have normally have lost during pregnancy does tend to fall out and fill the bath plug up when you wash your hair. But it's nothing to freak out about because it does grow back again. You get nice little new hairs growing through, and your hair does go back to normal again.
About 3 months after the birth, hair usually returns to normal, and regular visits to the hairdresser will keep it manageable.